We went from, I don't have the numbers right in front of me, but around 3 to 10 active cases to over 100 in just over a week. And I can reassure you, those numbers are not multiple tests on one individual. It's one test, one individual. So the 197 tests, that's one individual. Yeah, we have the numbers for those patients that are being seen or tested multiple times, but we only count them once. So again, it's 197 individuals with resulted positive cases. These numbers do not include serology testing. They don't duplicate one person, one time. So with that, knowing that with the increases that we've seen over the last few weeks, our board, your local health agency, is required to respond. We do what we can to slow the spread. We ultimately want to protect our citizens, our residents, our communities, ourselves, each other. So we do look at precautionary measures based on those numbers and how we, as an agency, as a community, as a group, can slow the spread and keep our healthcare system, our hospital, from becoming so overwhelmed that it's unable to respond and take care of the ill. Plus, we don't want to wait until the numbers are so high that individuals pass away and that our healthcare is inundated and unable to take care of the patients. Why not be proactive? Johnson County has done a good job of being proactive. The residents have done a good job of being proactive. So why stop that now? Just because we're not seeing the numbers Kansas City is. We're seeing an increase in our numbers. Again, that's not a scare tactic. It's not, multiple tests for one individual. It's one test, one individual, and it's an increase that we have seen substantially over the last week. We want to be proactive. So the board did elect, the Board of Trustees did elect to put the face covering order in place. This is an order for 21 days. And if everyone does their part, we hope that it can slow the spread. We saw that the stay-at-home order did that. We're hoping that this too can do that, slow the spread, so we are not overwhelming our healthcare system. What we're learning is that many people are asymptomatic, and what that means is they don't know that they're positive with COVID-19. And why does that matter? Individuals can spread the virus, they can put others at risk and not even know it. Wearing the face covering provides an extra barrier for someone who may be positive and not know it. It helps prevent spreading those droplets to others around them. Wearing a face covering may not keep you from getting COVID. However, it does keep you from sharing it. The face covering order requires individuals who go into a public location to wear a face covering. However, anyone with a medical condition, they're exempt from that. Businesses are not required to, if an individual tells you that they have a medical condition, you cannot ask them what their medical condition is. They are exempt from wearing the covering. Businesses are also encouraged, not just individuals, but businesses are encouraged to help slow the spread by placing signage in windows or on doors stating that masks are required. Businesses can refuse service. We've all heard of that no shoes, no shirt, no service. Businesses can refuse an individual, they can refuse service. We don't want to put any business at risk or make them feel uncomfortable. We do, however, simply ask that they do what they can to assist. Wearing a face mask is, again, it's another way to protect yourself, to protect others. It's our job at the health department to do the same to protect our communities. Requiring the face covering will help protect our county, our residents, each other. We would appreciate everyone's support of the order. It's not meant to create a hardship. It truly isn't. It's we hope, if anything, it saves lives, because we've done a good job here in Johnson County. We don't currently have a death, but why should we wait until we have one to take preventative measures, to take precautionary measures? We don't want to wait for that to happen. So as the numbers continue to increase, we're going to continue to take measures, because again, that's what we're here to do, to put those measures in place so we can protect ourselves and each other. So I think that's really.
I can take over, Mary, and answer a few of the questions in the chat. So first of all, what Mary was saying, I totally agree with. One of the questions that one of our employees had on one of our video chats was, aren't we going for herd immunity? They've heard me talk about that and how we either have to get a vaccine or herd immunity in order to be done with coronavirus. And it is true, but it is the rate at which we are passing it, which is the fear. So when we have those exponential progressions of numbers, we don't want to inundate the healthcare system. And when we talk about the healthcare system, we're not just talking about Western Missouri Medical Center. We really are talking about our ability to care for patients here, which is pretty limited, meaning resource-wise, and or transferring to Kansas City. So I want to speak to that a little bit. We had went over 4 weeks without an admission since that initial March into April timeframe. We really did bend the curve in this community, and we've been very, very proud. And I'm still proud of this community. And I know that there's a lot of differing opinions on mask wearing, but for the most part, this community has seen what we need to do to band together in order to make it work. And so we hadn't had an admission in well over 4 weeks. And then in the last week, we have admitted several. The reason we haven't really put out there, some counties, every county does it a little different. The reason we haven't said one hospitalized is that then if somebody knows somebody that's hospitalized, then they can put it together and know that the person's identity. And so we have been kind of careful with that just because the numbers have been so low. But we have gotten as high as 5 yesterday, which may sound really low to you guys, but we have an 8-bed ICU. So when we have 5 critically ill patients, and they're not critically, the severity of illness right now that we're seeing is not tremendous, which is a good thing. But those people, the whole point of it is that they can deteriorate quickly. So they still need intense monitoring. So we've been as high as 5. We were able to discharge a couple, and so we're doing fine. I'm comfortable with the 5 to 7, 8, depending on severity of illness in this facility. What we have to be careful of is the resources in which to care for those patients and to care for our community in the emergency department and the clinics. And so that is why I have been a huge proponent for masking in the workplace. What I feel like we have to protect is those employees in the hospital. If Rich, his officers, if he has officers contract this, then he really cannot do the right staffing to cover this community. I won't be able to, if my emergency department staff get this, and it spreads through them, then I wouldn't be able to staff the emergency department. If Lowe's, put any business, any one of us in business, could really put our ability in danger of being able to either provide the care, the service, the product, and the business that we want to continue. So I think instead of going with stay at home, and I don't necessarily see us progressing towards that again either. I think the whole point of masking is you can slow down the spread with masking. And when I say mask, I really am talking about these masks, by the way. This is the most effective mask. This is the mask that when the state came after our first big exposure here, they said this is what the nurses at the hospital need to be wearing. And our nurses have not contracted coronavirus from any of our positive patients. So we know that this, with some eyewear to cover mucous membranes, it works. This works. And so when we're greeting people in the public, those are the kind we're using. I think the cloth, it's been, I'm cloth, you're cloth, that's better, but it really is the most effective to have these loop surgical masks, to be honest. So in my opinion, we have had some nursing homes affected in this community. Have we had a hotspot nursing home? No. Have we had a hotspot business? No. Those are all thankful things. We have had community spread. We're also home to a university with a lot of young people. We have some risk factors inherently that make us, we could become a hotspot, and we don't want to do that. Again, because we want to keep doing retail, we want to keep operating. And so I think that's why masking inside the businesses is so important. And that's really my passion around that. The other thing, you know, we talk about the hospitals. When we were reopening, and this is in the government, this is in the federal plan, this is in the state plan, but you have to assess some of the things Mary and I have talked about that you have to assess to open back up. Were, do you have the ability to contact trace? Do you have, so if someone is exposed, do you know who all they've exposed? Do you have the ability to have the right personal protective equipment? Do you have the healthcare capacity? Kansas City is, I might have mentioned that a little earlier, they are experiencing some very high levels of patient population right now. And so that is kind of crunching on us and pushing us a little bit. We do have plenty of PPE to have opened that up, and you can readily, as a public, get masks now. But the other thing that we don't talk about very much is I know a lot of people want to have those at 11/24, the person that had it was at Casey's. You know, some counties have gotten that detailed, and we have not. And I'll tell you another thing is that if the rate of spread we just had, we do not have the resources at the health department to do contact tracing that quickly and that and then get that information out. So that is one of those details that I think is another reason, because contact tracing, the reason that's important is to decrease spread as quickly as possible. So the other thing I wanted to mention that Mary and her board told me, and I told some staff this at the hospital today, and they really made some sense, is a lot of people said, why did you wait till the 6th? And at first I said the same thing to Mary, why are we waiting until the 6th? And the reason they waited until the 6th is it was going to be really difficult to keep people over the 4th of July weekend from being around their family, maybe family that they don't see every day, any events. And so if people did get exposed after the long weekend, this past weekend, if we wear a mask for the next 21 days, then as people become symptomatic, they won't be spreading it. And so I think that's actually pretty smart. So we're not going to see the decline necessarily in the next 7 days because we're still infecting from pre-mask. So the 14 to 21 day will be the time period that we see if this masking is really effective for us. I think though that we can also see it in the number of cases that we've had from businesses. The other thing I want to talk about is testing. So I know businesses are sending people to get tested when they've had exposures. And I know that's it's a really frustrating process for the employee as well as the employer, because number one, our testing's not quick right now. Testing went up so rapidly in the state that our testing sites are delaying our tests sometimes as long as 5 to 7 days to get those results back. So people, you know, are trying to get those so they can return to work. It's very frustrating, and our processes, I mean, we test, you know, up to 100 people in one day. It's a lot of tests to make sure everybody gets their answer in a timely fashion. But we at the hospital, we actually did purchase another analyzer that will allow us to do COVID testing here in the hospital. And so in August, the plan will be that we can do the COVID testing here and we'll have same day results. So that is really going to help us as a community, because again, the longer you don't have the results, the more exposure you might have with other people. So.
Dorinda, there was a question about bandana versus standard blue ones. I'm assuming they're referring to surgical mask, but if that's not the mask that you're referring to, please let us know and she can respond to that.
So I know there's been a lot of talk out there about masking, and there's been some really people, we've all read the one where she compares, you know, she's an OSHA person and she's comparing them. Nothing that she writes in there is a surprise to me, because we have been really involved in PPE since the very beginning of this crisis. and there's different levels indeed. So we call this a surgical loop mask. This is not actually a surgical mask, like in the actual surgery and OR, they have more liquid impermeable masks, but those aren't the ones that are widespread available. And so these, though, are the level 1 masks that we use in healthcare. And like I said, when the state epidemiologist and the team, and they had been in New York, traveled around the country, I was really impressed with their knowledge. They said that this is adequate and good coverage. The reason you heard some PPE shortage stuff in the beginning is we are wearing these a little bit, wearing these against recommendation length of time. In the past, when I was a nurse at the bedside, we would wear this into a room and we would throw it in the trash. We would get a new one every time. We are not. I've had this one all day. I've had it on everywhere I've went. So people are using these for the whole day. N95s, let's talk about those. So even here in the hospital, we had a lot of staff that wanted N95s, which are they're more round and they're specifically, they can stop smaller particles from coming in. That's really the difference between this and that. The reason it doesn't work now, particularly now, is you don't want to wear that because you are protected, but if you're infected, it doesn't keep it from going out. So just like that Facebook post that everybody's seen, those N95s are really not appropriate to be wearing out in public. It doesn't protect anyone around you. It does protect you. And we wear those in healthcare only around aerosolizing or intubation, where those droplets can get small enough in size that they could get through this, only if they're aerosolized, like in intubation or a respiratory treatment, and then we put the N95s on. And that was one that we had a lot of shortage around in the beginning, and so that's not one I like to see wasted, especially since if one of us is infected and we have it on, we're not protecting anyone around us. So this compared to cloth, if you can get these, they're cooler, number one. They're more comfortable to talk in, and they are superior. Cloth, I've seen some articles, and I said this on the radio last week, you can find data to support any single thing that you want right now. You can support your opinion any way you want. But the NIH, which is a reputable National Institute of Health, they have done some studies on the mask use in healthcare providers. So just like I say, this has protected all of my nurses from getting COVID-19, they did a study of healthcare providers wearing cloth and healthcare providers wearing these, and cloth are not effective. So healthcare providers were getting it wearing the cloth. So. I don't know why the packaging says that. That's not what they say. You know, I mean, in the hospital, this is something we deal with every single day. That's how we protect ourselves from viruses every single day. One of the things that I tell people about this specific virus is what we don't know a lot about COVID-19. But what we do know is it's a virus. We know how antibodies normally work with viruses. And so we don't have any reason to think that this doesn't work just the way the others work. And so I don't know why the publicly available ones say that, but it certainly is not true. This is how we protect ourselves against viruses. And like, if you ever go back in time, if you've ever known anybody with a lung transplant or a transplant period, what do they wear everywhere they go? They wear this because they are immunosuppressed. And so they are susceptible to bacteria and viruses. And so they wear these loop masks, have for tens of years.
Mary, there are some questions about contact tracing in the chat. Let me find that.
Training extra people. One of them says, or we do have any plans for that?
Well, we have all the plans in the world for that. Unfortunately, it's funding and the resources. We cannot hire people if we don't have the funding for that. The state has been working on getting individuals that can help with the contact tracing. We have reached out to the state multiple times for assistance on that. We have been told that it's going to come out. It's going to be, you know, taken out to, or health agencies will have that at some point, but we continue to get the coming soon. Stay tuned, coming soon. So we would love to have that. We don't know if there's an end in sight for that, but right now we don't have the funding, so we're utilizing the individuals that we have. We do have UCM started sending some of their nurses over, helping with that in the beginning. Of course, school's out now, so there's not a lot that they can send over, so we're using some of our home health staff, nursing, to assist with that. We have PRN nurses to come in. We've got 4 here today that are actually doing the contact tracing, and we're doing the best we can with that. We can't get all the detail, unfortunately, because of the number of cases that we have.
You know, the other thing that is what I've noticed from the hospital standpoint, because we're doing the bulk of the testing, is we aren't doing contact tracing, but we are advising businesses so often that businesses end up doing their own contact tracing a little bit, because you're trying to make sure in your workforce who has exposed who. And so that has helped. Herd immunity question about, someone said, do I want herd immunity? Yes, I want a vaccine for herd immunity. I just don't want it fast and hard where we can't handle it and people die because we don't have the resources to care for them. That's really how I feel about it. Asymptomatic percentages. I want to know that too. We're digging that out. I want to know what percentage of our positives have been asymptomatic. So we don't have that number yet, but we are actively trying to get that. It's a consistency of how the orders put in, whether they had symptoms or not, and so we have to go in one by one, and so we will get that. That'll be available. The KN95 and the N95 KN, I think those are for nail places, and I only know that because a nail place they donated some KN95s to us early on, and they do the same properties, they do the same filtration. It's just that they are overseen by a different, the N one is medical grade, and I'm sure that's why those other ones are saying not for medical, because they aren't inspected for medical use, and that's why they're saying that they won't work for medical use, I'm sure, because everybody started putting out masks. We even have gowns that Ford Motor made for us, so and they have to tell us these may not work because they haven't been medically graded, approved. There's a couple other questions I think I do. So false sense of security. I think when you wear this, there is nothing false about it. I have felt the safest at work than I feel anywhere in the whole world, because everywhere I walk in the halls, everybody has a mask on. So this makes me feel safe. Even when you don't have your mask on, I know this protects me as well. So because it does. And the reason I know that is because this is all we've had on our nurses that have been actively caring for COVID-19 patients in the hospital and in the emergency department and express care and other clinics. And we have had, almost all of these 197 people are patients of WMC, either the clinic or have been seen in one capacity or another. This is all we've had people wearing. They have not contracted. We only had one positive employee until just the last week. And we have a couple more, but it's all from outside exposure, from people outside of here. So this works, these work. So I don't think it's false. I think it's real. And if you go into another county, I live in Pettis County, and I wear this there because it protects me as well as the other people around me.
Going on that, here at Johnson County, we have several times our employees we don't have surgical masks to give everyone. So our nurses in the beginning started making cloth masks. And so we have different types. And there's 2 layers, and they sewed those together. And our nurses have actually, the home health nurses have been wearing those out to see patients because we were limited on the supply of PPE that we could get. We haven't had any nurses that have contracted COVID. We did have a patient that home health was seeing that was positive, and our nurses have stayed safe. So again, it creates a barrier. It's not just surgical masks. We're using cloth ones, and they're creating that barrier, and our employees have been able to stay safe.
Particularly if both people have it on, and we're giving cloth out to our visitors because we can't afford to give all of our surgical masks away.
Not when it's limited.
I'm just encouraging people, if you see these at Westlakes, which they have them at Lowe's and everywhere, buy them because they work and they'll make it better. The cloth is just not as efficient of filtrating the particles. But there's different cloth ones, though. They even have some that you can put filters in. I mean, people have gotten really, really creative. But if you see them, buy them.
Well, there's a couple of questions I know on here. People are asking about penalties for not wearing masks. So I guess that's the point at which the big bad police chief has to come in. So, hello. So there is, it's a county order. So there is a potential for a $1,000 fine for not wearing a mask. There's also a city ordinance that you could be cited for that carries up to a $500 fine as well. Really, that's not the reason to wear a mask. It's similar to a speed limit. We all drive the speed limit because we know it's safe to do so. Some of you, and I know, go a little over, but when you're going way over the speed limit, that's when it gets unsafe. We can't ticket every speeding motorist. And so what we rely on in law enforcement is voluntary compliance with laws that our elected officials and our lawmakers deem appropriate to keep our society safe. And this one's no different. Your county health board of directors and your county health administrator said, hey, look, we think this is what we need to do to slow this down. They've passed it. I don't make laws, I just enforce them. And so what we ask for is voluntary compliance with folks. We were inundated on Thursday with calls, with emails. People were calling 911 to speak to an officer about whether there was a fine for a mask. I don't know about you all, but there's something wrong with that. 911's for emergencies, not for calling to talk to an officer about whether you have to wear a mask. It got to the point where I had to tell my officers to quit responding to the calls because it was interfering with their ability to deliver basic service to our community, which is what we're trying to do. The other thing Dorinda hit on it is, as your police department, you may not know, our staffing level isn't like flush with officers. I don't have a bunch of extra ones. So what we've been trying to do is limit our public interaction so that we don't get exposed to potential sources of COVID-19, because it can run through a police station very quickly. And if that happens, then our ability to provide basic service is going to go down. We don't have anywhere else to get police. I can't call up my former department in Kansas City and ask them to send officers down here because they've got to deal with their own issues up there. So we actually started on Thursday. The order was announced on Wednesday. We started Thursday morning at 7 a.m. I didn't give them the 4th of July holiday. I told my officers to start wearing masks. And some of that had to do with, I was doing a radio interview on Wednesday, and one of our viewers said, "Where's your mask?" And my response, because sometimes I like to give out a quick response, was, "I'm socially distanced." And she said, "Well, what about setting an example?" And she was exactly right. It was later that afternoon when the health order came out. So for us, your law enforcement agency, we started wearing masks Thursday morning, and we've gone back and forth as a community and as people. Does it work? Does it not work? I can tell you a mask is better. A cloth mask is better than nothing. A surgical mask, like Dorinda talked about, is better than a cloth mask. A KN95 or an N95 is better than that. And we got gas masks. So I can throw a respirator on with a Tyvek suit, and that is the absolute best protection. So what we try and do is we try and balance out protection with comfort and the ability to do your job. So for us, we have tactical vests that our officers wear when they do search warrants. They weigh about 60 pounds, and they're very heavy. That provides the best protection for our officers. But we don't do that every day because the odds of me needing that level of protection every day are not as high. So we have a lower level vest that we wear every day. And so again, it's all about protection. It's all about trying to remain safe. And that's why we're asking people to do it. That's why we want you to do it. The police department, if we see people not doing it, we're going to remind them, hey, this is what we're trying to do. This is what we're trying to accomplish. And if somebody's just, not doing it and unwilling to cooperate, then there is that opportunity that they may get a reminder that tells them in a monetary way that they have to continue to wear it. Oh, there was something that came up earlier too. Somebody asked why this forum wasn't done earlier. I'm a part of the PIO group for the task force, and it was really just logistics and scheduling, trying to get everybody scheduled together. Mary's been busy, Dorinda's been busy, I've been busy, and then Suzanne at the chamber is the gracious host for all of this. And so this was really the earliest we could get it together for everybody being here at the same time. So I understand that people would like to have information sooner, and I get that. We really try with our Facebook page, the Johnson County Emergency Operations Facebook page, get that information out as quickly as we can. And so this was just the first opportunity we could do it. And I really want to thank Suzanne for providing the opportunity for us to be here and to have this forum for everyone. And thank all of you for being here.
Mary, there is a question in the chat about gyms and wearing masks, and they were asking if you could clarify on the stance on youth sports in an indoor facility, or really anybody.
Okay, the masks are required when there's no social distancing, when that cannot be maintained. I know it's difficult for sports and the gym, as long as social distancing can be maintained, or you're on separate equipment where that distancing is maintained, the masks can be removed. In events where sporting activities, we are requesting that individuals do their best and try to wear those masks if the social distancing cannot be maintained. However, we understand that's difficult. Again, it's all about us doing the right thing and wearing our masks when we can. And I know this is on a different, there's been a lot of requests on data that individuals are wanting to see on the Facebook page. We hear what people are requesting. Unfortunately, we are working as quickly as we can. Johnson County is limited on the staff that they have working on COVID. We have an agency, however, we have home health, which is the majority of our employees. We pull the nurses once in a while to assist, but again, they've got to go out in the community and see those patients. So we have 4 people, maybe 5, that are working all of Johnson County, a population of 54,000 people. So when those tests come in so rapidly, there's 3 of us that are trying to work those and get that data put together. So we hear what you're saying, we hear the information you're wanting to see. It just takes time. We're working long hours, even beyond the 8 to 5, and we're doing our best. So,
Amy, I've ignored your question twice. I've started to answer it and got sidetracked. They can, anytime this gets crumpled or moist, they change masks. So they wear it honestly as long as they can until it gets moist through that day. Now, those of us that are not clinical, I try to keep the same one all week because I'm alone in my office most times. But if anybody comes in or I leave, I put it on, and I can usually keep it in good condition. But the clinical staff, I mean, we want them to have the most access. And so obviously if they feel like it's been destroyed in any way, either by moistness or crumpling, then they get new.
Hey, Dorinda, there's a question about the proper way to wear a mask. Can you demo that?
Sure. So above on the bridge of your nose, You know, these have that nice little metal piece so that it can give a nice snug. Now, people will say sometimes that their glasses fog. What we found, we did a little bit of research, and apparently if you wash your glasses with Dawn dish soap, that it makes it where they don't fog. So that's just a tip that we gave out to some employees. And then pull that down so that it's fully covering your mouth. But my face is big enough to wear this. I noticed some very skinny people will do this because it's gaping and they're little. So it is about getting the right length of loops for your ears. I notice I've got some cloth ones that are huge and fall off me, and I've got some cloth that are tight and pull my ears. So it really is about getting the loop to fit your ear correctly so that it fits nice and it's comfortable. I think these calls are helpful.
I do too. It gives us a chance to visit with people and get that one-on-one. If you aren't following the Whiteman Facebook page, Colonel Schreiner's been doing some town hall meetings with Whiteman folks. Great opportunity to get messaging from them as well. And, you know, they're covering a lot of people and responsible for larger area. And so they can give us a bigger perspective rather than just our county as well.
Yeah, they have a lot of people that can track that data. And so that's really helpful to us. Someone asked a question about, I think Sharon said we went up so quickly. And do we have any hotspots? Well, first of all, I'm having trouble. I'm sure the health department is doing better than this, but I'm actually putting some employees to help with this on our side because we do so much of the testing. Because when I'm out and about and talking, people ask me and they expect me to know, you know, where are the cases, where are we at? And so knowing those buckets of people would be helpful, meaning, is it UCM students? Is it nursing home patients? You know, like just knowing those buckets. We do not have any real hot spots. You know, we're not on the news for a Tyson plant or a meat packing plant. You know, we don't have any of those, but we have more than one case in about every bucket, you know, so at the college, at a business, at a nursing home, you know, so it just honestly, it's come from a lot of different places. And we do put sometimes the age of the numbers. I know that goes on our JOCO emergency operations page sometimes, and it is a younger population that seems to be climbing quicker, which would make sense for us because we have a young Whiteman population, we have a young UCM population, and so that seems to be the clients that are climbing. Those aren't the clients I'm really worried about. I'm really worried about elderly folks. And then I am worried about the young ones because they're the ones serving us and keeping those retail businesses going and those kinds of things. So.
And it's funny, Jager had a question about, you know, wearing masks don't keep you safe from a virus. She hasn't seen the recommendation to cut out processed sugar, increase vitamin intake, exercise. You're looking at a guy that needs to do all of those things in addition, but wearing a mask is so much easier than cutting out processed sugar and exercising. So I'm going to do that for right now. But the COVID 30 hit me hard. So I will definitely do that. Yeah, it's not been good, but you're right. This is just one aspect of safety. All those other things contribute to diabetes and high blood pressure and all those things. And so, you know, this one's just really simple, and that's why we're trying to communicate it very clearly. But certainly those other messagings are important as well.
Well, and there's a question on there about shutting down Walmart or Lowe's if they don't comply with the order. They currently are, and I think they will stay complying with the order. If they do not and it's reported, the first thing we'll do is get in touch with the managers at those locations and work with them. It's not going to be a matter of, you know, reporting them and then them closing. It's going to be a matter of working with those managers at those locations to get them to follow the order.
Somebody asked about Burger King being closed, and I'd heard McDonald's closed their lobby. One thing to keep in mind with some of these national chains is they follow corporate policy that isn't localized. And so businesses can do that if they want to. And so you may see some of that. It doesn't mean there's a problem here in Johnson County. It just means that their corporate policy dictated that they were going to take certain actions, and the local franchisees have to follow that.
And that's why you see some businesses, they still have the tables blocked off that you can go into, depending on where you go. It's a corporate decision.
I think Brian has a really good point. Those net gators are probably easier for little kids. I just don't even know how the daycares are doing it or how schools are going to do it. I mean, I'm really nervous about us starting school and how that's going to go.
And I think they're still having those conversations about what that's going to look like. I was at UCM today, and they're still not sure what fall semester is going to look like. So we've got graduation coming up the 25th, and that's still kind of up in the air. So I think a lot of people are still trying to figure out what things are going to look like. When you have 72 new cases in a week, it certainly caught all of us by surprise. And I think that's what we've been trying to figure out is how do we handle this moving forward.
And we've been working with the schools as much as possible, including UCM, the high school, talking with those to put some guidelines together, recommendations. So hopefully they can make a good decision on when they reopen.
And again, I think somebody's asking about the Gators. I think Dorinda would probably agree. It's all about having something rather than nothing. Mm-hmm. So, you know, the nylon Gators, they're usually probably 2 layers of fabric. Yeah, stuff's going to get through those. So it's not the best protection, but it's better than nothing. And so I think that's kind of the rule I think we're trying to follow is something's better than nothing, you know, all the way up to, you know, like I said, the Tyvek suit with a respirator. That's the most protection. So think of it as a continuum, and figuring out where you are in that continuum is kind of what you have to do to create that balance of protecting yourself, protecting others, and our community.
A question just came in about providing guidance about wearing masks for children under 5.
Well, the order states as much as possible with parents' supervision for children over 5 to wear masks. Children under 5, I don't know that we address that. I do know that 2 and under should not wear a mask due to reasons of suffocation. So we really didn't address the 2 to 5, but I would say that if the parent was parent supervision, they could have the child wear a mask or a gaiter or some type of cloth. Again, I know it's difficult in situations, so as long as we're doing the best we can, each individual parents and children.
Well, and a lot of this too, I think, is about, you know, individual responsibility. So, you know, for my family and we just made the personal choice. We're just going to start self-quarantining again, and the kids aren't seeing their friends. And, you know, but I think that's an individual choice. I don't know that we can force everybody to do something like that. But if we all do our part, then it does help make our community better. And that's really how we get through something like this, is as a community, not as individuals working against each other.
And John Mark, and I'm probably not the only one who can answer this, but we're all probably going to answer it pretty similarly. Businesses should not be allowing patrons to come without a mask given this order. But like, you know, Captain Lockhart said, Mary's not out detailing the businesses that are accidentally letting somebody slip in. So I don't know, Rich, if you have any more guidance on that, if businesses.
Yeah, I mean, we don't want to get a flood of phone calls, you know, telling us that somebody's not doing something. What we try and look at when we're dealing with things like this are problem areas. So if we've got where there's a business that consistently isn't following the order, then we're going to go visit them and say, hey, look, how can we help you guys follow the order? Because it's really about safety. But also as a customer of the business, you ought to insist on it. And you're spending your money in there, and let them know that the order's in effect, they should be following it. And if they're not, then as a customer, you can always make a decision to shop somewhere else.
John Mark, if there's another, I'm having trouble finding if there's a different question. Okay. Looking at shutdown, I think that the thing that Mary and I talked about just today, you know, it really is us continually talking about, do we have the space to take care, the capacity to care for patients? Do we have PPE? And so for me, I think that's why it's the most important thing to try and preserve our workforce, the healthcare providers. And so that's why I've been on the front end of more vigilance by staff, because I can't afford for the community for us to not be able to care for our community if we do have an outbreak. So I don't think that the county, none of us have talked about, are we going to require a vaccine at the county level? But if you're an employee of the hospital, you will be required to do the vaccine when it comes out. Just like we require the flu vaccine. I don't know if everybody knows that, but every employee that works at the hospital has to take the flu vaccine. And it is about preserving our workforce while also protecting the patients that we're caring for. So we will be required to take a vaccine unless there's a contraindication. But I don't think there's no level of talk about that at the county level, not to mention they won't have a vaccine readily available for everybody for a while. Oh, the eating thing, you know, forgot to mention that. At the hospital, we implemented not just masking, but just last week, we do solitary dining. And it's sad and it's lonely, but there's no point in wearing these all day if then we go to the cafeteria and sit together and eat. So, no, we have one chair at every table in the cafeteria. Nobody can sit together. The rest of us eat at our desk. We do a lot of Zoom. We have a lot of lunch meetings because that's what people are in between clinics and those kinds of things. So we just do Zoom, we eat at our desk. So I agree with you. I mean, once you start eating and drinking, that's just like, you know, the bar thing, you've totally negated wearing your mask with that person. So in the workplace, we're doing solitary dining. Not probably possible at every place of employment, but.
Figure, I don't know if Mary saw it or not, but the health department board is an elected board. Yeah. And Mary, maybe you can address that one.
Well, I haven't been here during one of the elections, but they are an elected board, and they do come up for election every so many years. I believe it's 2, if not 3, that they come up for election.
Somebody was asking about legal action if somebody's not able to wear a mask because of a medical condition. I don't know that any of us can answer that question, but if you have a question about that, you could probably contact an attorney and see if there's some way to get a waiver or something like that. I'm not aware of anything like that at this time.
I don't know that, I mean, with this mandate or this order, you don't have to have something in writing if you have a medical condition and cannot wear a mask. Businesses should not be requesting information from you or a waiver or anything like that if you have a medical condition.
And Jocelyn, I share your frustration with the inconsistencies being consistent. You know, when all this first started, they told us not to wear masks, and now they're telling us to wear masks. And I think part of that relates to the nature of what we know about the coronavirus. When all this started, they called it the novel coronavirus because it was new, and we were beginning to learn more about it all the time. And so, you know, I share the same frustration. And you know, we're people just like all of you. We just get charged with having to make decisions that affect people that are part of our community, and you know, it's frustrating for us. It's not necessarily what we want to do, but we're trying to do our very best with the information that we have, and knowing that it's always changing information. And you know, not everybody's going to be happy with it, but leadership is about making the decisions that will affect the greater good. And you're doing that with the best information that you have. For you Star Trek fans, you remember the needs of the many outweigh the needs of the one, is what Mr. Spock said. And that's kind of what this is here, is for our community, the needs of our community outweigh the needs of any one individual. And so that's kind of what we're trying to do here. So know that we all share your same frustrations. We wish we had all the answers and all the information to be able to say, hey, this is the one magic bullet that will get this done. We haven't found it yet.
I agree with that. I say all the time that you can find whatever you want out there. I don't do any reading on Facebook or anywhere except for actual medical journals, and even medical journals, they're trying to disprove because they're scientists, but it has not changed in healthcare one bit from the beginning. You know, this mask has been the standard from the beginning. We haven't changed. And so we know that it's a droplet transmission. I know there's a lot of talk, is it airborne, is it droplet? It's droplet until proven otherwise. So we know how to protect ourselves against that. But the media has made it very difficult to think about as a community how we handle this. And I can see why people get so frustrated and confused. I have a protocol for positive patient or employees, and I think we shared it after the last call. I can share it again. So if your employee tests positive, Mary's people will also give you guidance, but sometimes we talk to you and it takes a while before it gets through the whole system. So sometimes we're given the guidance, but people do ask me. So if your employee is positive, obviously they stay home. If you are all wearing masks, then their coworker is not probably a true exposure. So they can continue to wear their mask and just monitor their symptoms, check their temperature, and those kinds of things. But if they were definitely exposed at work, so we had some businesses that had close proximity and they were not wearing masks at the time. And so if this person tests positive and they stood next to this guy and talked, you know, all day, every day, then this person, the state would tell you that you just put a mask on them and you send them to work. That's really what the state is saying now. And so what we do at the hospital is that we're already masked, so our exposure rates are low as long as people have kept them on. But we do test them at 5 days past exposure. 5 to 7 days has been the average we've seen that symptoms have started. And so at 5 days, we test them, and then we let them go back to work with their mask, continuing to monitor their symptoms in case their incubation period is longer than the average. So it gets really sticky. And so our business education group can help through our task force. We all have people on that. And so I have a person here that leads that. And so she can help give you some advice. It gets real sticky though. You know, I've been asked, what if a daycare teacher gets it? And I know Rhonda at the health department has to deal with this all day, every day. This masking adds one more layer. So now that they're masked, the teachers, what if one of them becomes positive? Do you have to shut down the class? I don't know. You know, it is kind of what Rich said. We have to learn to do what's tolerable and what's safe. And in the past, during this episode, we just shut everything down and we killed the economy, and we, you know what I mean? Like, that's what we did. We shut everything down because that is the most effective way to stop the spread. But is that the most reasonable way to stop the spread? So every one of the work scenarios are a little bit different. And I know that those of you that are sending people to get tested asymptomatic, insurance does not pay for asymptomatic testing. So the people are having to pay $100 for asymptomatic testing because that's actually what it costs us to send it away until we get our own analyzer. And so that's not always quick. There's no sense in testing an exposed employee until it's been at least 5 days after the last known exposure of the person who has it.
One thing too to keep in mind, I know there's a lot of questions coming in. People are wanting to know where to get more information. The Johnson County Emergency Operations Facebook page is monitored, not 24/7 because we have to sleep, but it's monitored every day. And so you can create a post there or send a private message. And we are pretty good about getting back within just a few hours with information from the people that you're seeing on this call, from either Mary or Dorinda or anyone else. So utilize that, like it, share it, let people know. You don't have to wait for a Zoom meeting or a report to come out. Any of those comments there get answered pretty quickly. There's about a dozen of us that look at that every day and handle all those calls there. Oh, and Tara just posted in the comments. So now you can just click on it and go right to it.
Amy, the restaurant thing, you know, Mary does have jurisdiction over the restaurants. That's what we do know, because the health department is who approves restaurants. And I haven't been out to eat much at all in Warrensburg particularly, but they should be doing social distancing seating. That's never changed. Masking or no masking, there probably should be tables blocked off, or tables they're not using, and if they're not 6 feet apart. So I don't think there's any changes coming, because they should have already been following that.
We do have our environmental health, which go into the restaurants. They're the ones that do the inspections. They're the ones that issue the permits. They do go in, and I've not heard of restaurants not doing that, but if there are, we can definitely look into those. We just need to know about those.
Well, thank you very much. There were lots of questions there. Oh, one more, a couple more just popped up. Thank you for your time. There's another one, Mary Durinder. I'm not sure if you can answer that before we close the meeting. From Justin.
Back up at the top too, I missed one earlier. It says, what's your recommendation on eating out, dining in a restaurant? As long as you feel like you can be socially distanced, and the staff are wearing their masks, then I think it's safe to eat there. But I have heard from people that they don't like eating places that don't wear masks, which should be taken care of now that we have this order. And I agree with that. So I think they should be wearing masks to serve me food.
And I love to eat out, and I can tell you, I'm doing all takeout now. So.
And Dine Dash is my best friend. I haven't gained 30, but I've gained a lot too. How sick our positives have been. You know, this is something I have somebody working on this data too. So what's the percentage of asymptomatic people that have tested positive, and then how sick? I have said in many public venues that I feel like the severity of illness that we are experiencing right now in Johnson County is lower than it was at the end of March. And the reason I know that is because I work with the physicians every day who are caring for these patients and or the ones who are being admitted. So I don't know what that means. There's no scientific evidence behind it. Like I can't say that it's not as viral as it was, but right this instant, thankfully, knock on wood, we have had this huge influx, and we haven't had like severely ill people that have, you know, had that really bad course yet. We haven't had that yet, but doesn't mean we couldn't. But right at this time, that's what we're seeing in the hospital is a little less acute. But we also have good protocols to take care of them, to be honest. I mean, our physicians are really, if you get admitted with COVID-19, like they're doing all the best practice evidence. I mean, you're not just being admitted to put oxygen on you. They're giving you medication. We have all those things those medications that are, you know, top lock on that not everybody gets. Our physicians and pharmacy have done a good job trying to treat the patients. And so I think we've done a good job with that.
There's a question on here about the elected board and how to contact them. They are an elected board. They don't have an office in the agency. So what they have is personal contact information. So that information is not available on the website or on Facebook or anywhere for that matter. They do ask that any communication to the board can be mailed at the agency, and it will be provided to them.
Amy, we rotate ours in non-clinical people once a week if it doesn't get wet or crushed. I keep one in my car that I can wear to and from into my office, and then I keep one at my desk. The cook should have a mask on. Lois is having some trouble with people entering without a mask. Do we have Mary, did we give a sign? Do we have a sign for businesses? Like, I actually went to Florida in that little window of time that the beaches were open again. I went to Florida and I'm past 14 days, so I didn't catch the COVID, okay? But they all had big signs on their doors. We couldn't go anywhere without a mask on.
Yeah, we do have a sign that's available out on our website that businesses can print off and post. I don't know that it's available on Facebook, but I do know it's out there. If you go on our website, which is johnsoncountyhealth.org, go under the COVID tab, and you should be able to scroll down a little bit, and there's one that says a mask is required.
80% of people will follow that sign. 20% might not, but that certainly helped. But it's a little bit of social pressure. I mean, I felt that when I went to Florida, like, because there was this big sign, and so we felt like we weren't audacious enough to walk in without a mask and then have everybody else looking at us when we should have had it on. I think the sign does help as a consumer. If you're totally against masks or you have a medical, I hear your concern, because if someone comes here to the hospital, medical issue or not, I'm not letting anyone in this hospital without a mask on. I mean, it's not happening. We will figure a way to get you where you need to go, but you're going to put something on. I mean, we're going to figure it out. So because we're a necessary care place, we will figure it out. You don't have to go in Dollar Tree. So if you ask people to please place a mask, we're also going to have masks available for purchase at the doors. A lot of places do that. Menards did that a lot in early. I heard Walmart was handing them out yesterday. So that's the other thing, is handing them out. But if people say have medical conditions, it is really hard. And as a rule, we don't ask for documentation on anything like that. But the order clearly says that you can refuse service.
Well, I think Jamie's got a great idea here. She just was responding to Lois's question about that. She said, we've told people if they do not have or are not willing to wear a mask, that's fine. We will assist them at their vehicle or curbside.
Right.
So that's their option is, I mean, and that's I think the value of community here is come up with these creative solutions. So you're not refusing service. You're just saying, hey, you can't come inside, but we'll help you out here curbside. And really, I mean, that's where we want to get. I don't want to be handing out $1,000 tickets. It doesn't serve any purpose except for making people mad. So let's figure out a way to get through this, follow what we've been asked to do, and come up with those creative things. I think that's the value in an event like this. It's the value in community and talking to people about how do we work through this to make our community better.
That's a great idea.
Kimberly, I have a Garanimal homemade mask right here that I've been wearing. I also have a KN95 that if I'm really feeling masochistic, I put on so I can suffocate. But the cloth ones are what I've been wearing, and these were, somebody made them and donated them to the police department. And so, again, it's varying levels of protection, whatever you want to feel safe with. That one's got 2 layers of fabric, so it will help. But if I'm going somewhere where I'm more concerned about exposing people or being exposed myself, I'll wear one of the KN95s without a valve on it. That's the other thing too. Some of them out there have the valve on them. If you use the ones that have the valve, you actually do expel the virus in droplets, so you don't have the same level of protection for other people as you would if you have one without the valve. So those ones with the valves are great for you, but not great for anybody else.
And to go on that, here at Johnson County Community Health, most of our employees are using cloth, 2-layer. Like I say, the nurses spend a day in March making masks. I have one here. It's a double layer, but it's also got a wire sewn in it. So it's a lot like the surgical mask where you can bend it and fold it over your nose. So a lot of us are using those. We do have the surgical masks available. We do have those available for the public when they come in and don't have a mask themselves, because we do require that as well when they come in, just like the hospital is doing. Anyone that comes into the health department will be asked to wear a mask.
Well, thank you very much, Dorinda, Mary, Rich, Tara, and everyone who joined us on this call. As Mary and Dorinda and Rich had mentioned, you can reach out to Johnson County Community Health Services, and they will be able to answer questions further if you have any. I thank you all very much for participating and joining this virtual meeting today. We've got some more messages coming in. Make sure we've addressed everyone.
I don't know what brand of masks. I mean, obviously, I think we use Medline because we have distributors, but I bought some at home, literally at Westlake, that look just like this. They have them on Amazon too.
Just thank you again, everyone. Have a good rest of your day. Thanks.
Thank you, Suzanne. You too.
Thanks. Bye-bye.